Now, this might sound hard to believe, but the first confirmed COVID-19 case in the United States was more than 5 years ago. And of course, so much has happened and changed since then. And that's why we reached out to local medical experts. We wanted to find out where things stand now and how this virus will continue to change in the future.
They spoke with ABC Action News reporter Larissa Scott, who's covered the pandemic extensively. She joins us live this morning with the details. Good morning, Larissa.
Hey, good morning, Andrew and Dia. Over the past 5 years, our local hospitals have been filled with COVID-19 patients. Thankfully, those numbers look much different today. And while we have learned a lot, health officials tell me there's still a lot we don't know.
On January 20th, 2020, the CDC reported its first laboratory-confirmed case of COVID-19. Then on March 1st, 2020, state officials announced the first 2 cases in Florida, in Hillsborough and Manatee counties. We spoke to some of those people who had the early infections back then.
Being one of the first cases in Florida and the first case in our county, there were no COVID tests. So it was sort of a difficult time.
It's been a whirlwind since, with lockdowns, curfews, masks, social distancing, at-home learning, working from home. So many unknowns.
We've seen, in real time a pandemic happen. We don't often see these things, right? Once every 100 years or so.
Since 2020, the CDC reports there have been more than 1.2 million deaths in the U.S. caused by the virus. Within 11 months of that first case, we had a vaccine, a major public health achievement.
But not just that, the medicines. And so we've been able to make some monoclonal antibodies. We've been able to make some antiviral drugs, and they're really just getting better over time as we make more and more possible treatments.
So where do we stand now with the COVID-19 virus? It's still here and evolving, but the disease right now is much milder because so many of us have antibodies.
We're starting to understand the course of the disease better than we did before, starting to get good data on long COVID, who's affected.
The COVID-19 vaccines continue to be seasonal boosters like the flu shot. Drug manufacturers are hoping to have a flu-COVID combo shot this fall. They're also trying to make some other vaccine improvements.
There's some preliminary data that states that one of the vaccines may actually prevent infection.
Some health officials believe it's possible down the line that we could get rid of the virus altogether and eventually stop vaccinating.
We'll see what the virus does, right? Because there's a limited amount of mutation that can happen.
Others think if we stop vaccinating, the virus could mutate and cause another massive wave with severe disease.
It's anybody's guess. We don't know what's going to happen. Historically, we just don't have enough data to know what's going to happen.
And it's important to mention that we couldn't have gotten to the other side of this pandemic without all the help of our brave healthcare workers. Officials tell me should we see another pandemic in our future, we'll be much more prepared this time around. I'm live in Tampa this morning. Larissa Scott, ABC Action News.